Welcome to Trifecta Collective, Finding the Root, where we dive deep into understanding and addressing root causes of chronic health issues so you can help and find healing inside and out, now and forever. Hello, and welcome to Trifecta Collective, Finding the Root. I'm Megan Abbott, owner and founder of the holistic health practice Trifecta Collective. Welcome to the podcast. So today I wanted to do something a little bit different, and if you guys want me to do other episodes very similar to this, please let us know on socials, send us an email, just like let us know, comment, like let us know somehow. And I am going to put a survey up on probably Instagram. I don't know how to do maybe TikTok too. I would TBD on that one. So today I'm going to do an episode all about, and I picked three kind of the common issues that we see. And I want to walk you through essentially how we peel back the layers and find out the bigger root causes of issues that are going on and different things to think about when it comes to these kind of more common issues. And these for me are these are symptoms that can have a lot of bigger root causes. And I want to walk you through essentially like the thought process that I would go through, that the whole practice would go through in identifying bigger root causes of different issues. So the three I'm going to talk about today are constipation, thyroid issues, and I am putting thyroid issues as a blanket statement. And I know there's can be a lot that goes along with that. There can be an autoimmunity piece, there can be hyper, and I'm going to talk about a lot of that too, and different patterns that we can see within thyroid markers. And then I'm also going to talk about, assuming I have enough time, lower back pain. And if I happen to go through these three really quick, I do have another one in my back pocket just in case. And if you do want to see more episodes like this, please let us know and let us know the issue or issues that you would like me to talk about and kind of peeling back these layers. And once again, this is really going back to what is root cause healing? How are we different? How do we approach root cause healing versus maybe some other people? And I'm going to talk about obviously physical issues that can go on, nutritional issues, movement issues, especially I picked lower back pain specifically because there's a lot of things, especially when I was going through my lower back pain issues and when I specialized in chronic pain issues for several years from a personal training perspective. And even when I first started this practice, I was working with a lot of chronic pain individuals. A lot of things that people don't think about that I want to talk about here. So, yeah, let's just dive in. So, the first one here is constipation. So, constipation, I always like to look, what is the lowest hanging fruit when it comes to a lot of these issues? The number one lowest hanging fruit I think of is water intake. How much water is someone actually getting, and how much are they drinking in a day? And here's the thing about hydration. And if you don't know, we did a whole episode on hydration and minerals and things like that, which was a great episode. And we get a lot of people that are like, well, I don't drink plain water, but I have the bubbly water. I drink herbal tea. I have coffee. I have caffeinated tea. I have, and some of those things count. Some of those things are dehydrating, you know, base level. And we could dive into like, what is actually dehydrating? How is it dehydrating? Things like that, which I'm not going to get into right now. But typically when we think about certain things that have caffeine, typically they are going to be dehydrating, specifically coffee and teas. And even herbal teas, little bit of some mixed information, like are they actually hydrating? Are they dehydrating? And I think it could go either way, but regardless, I want someone to be drinking plain water. Just, you can put electrolytes in it for sure. That's totally fine. If you want to add some flavoring, not my favorite. And I get it for a period of time as you transition. But I'll tell you, water itself Tastes amazing, especially when you get good water. And I know if you're not a big water person, you're like, I don't even know the difference. What is good water? What is bad water? It has no taste. It does. Fresh water, filtered water, like a good quality filtered water. And I'm just like looking at my water bottle right now, and I'm thirsty. And I'm gonna take a drink here in a sec. But real water tastes so good. When you kind of bring yourself out of all the sugary drinks, when you bring yourself out of needing all of the flavors for everything, man, a real water has amazing, amazing taste. It's so refreshing, it's so soothing, it's so hydrating. And you can feel it. I like feel it as I'm drinking it. I was not always a big water person, for reference, especially up until, I'm not sure, probably mid somewhere between like early to mid 20s is kind of when I started upping my water game and really focusing on my water intake. But until then, I didn't like going and using public restrooms. And so I would not, at school, anytime I was in school, I would not drink water. College started to shift things a little bit because I lived in dorms essentially the whole time, and you didn't have a choice. So that shifted my perspective, forced me to make some changes myself, which obviously was good. But plain real water, and I do put some electrolytes. I use salt, SALTT, the plain unflavored version. I use a little bit of that in my water every single day. If I'm going and using the sauna, I'm just thinking about my day to day. I'm going to use the sauna today. It's going to be a little bit on the warmer side, and I do plan on taking a couple walks today. So I'll probably go through half a packet, maybe half to three-quarters of a packet. Otherwise, I'm doing about a quarter to a half of a packet a day, just kind of depending on what my nutrition looks like. Where am I getting sodium, potassium, and magnesium from? If I happen to have something that's going to be a little bit higher in sodium, maybe I'm not going to use that as much. Maybe I'm having a bunch of greens that have a lot of potassium. Maybe I don't need as much. So those are some things that I think about when I think about electrolytes and water intake. But hydration is a really big one. And I can tell you that this almost for sure likely played a big issue in my chronic constipation issues. And that started for me when I was young. I mean, I was admitted to the hospital for constipation when I was in high school, I think. Some of my timelines get a little become a little iffy. It was either late middle school, early high school that I got admitted for chronic constipation issues. I was on Miralax forever. I mean, it wasn't until my later 20s as I was going through my healing journey, and it took a while going through my healing journey. Maybe it was even when I was 30 that this really started to shift, that I started being able to go regularly. For a while there, it was with supplements. It was with Bowel Mover from Cellcore. I mean, I did magnesium citrate forever. I did all kinds of stool softener stuff, Miralax, all that kind of stuff. And yeah, it helped sometimes. And also sometimes it made me worse. I'll say even still, magnesium citrate and I don't get along, especially because for me, the hardness of the stool is not the issue. If I ever do have issues, it's a motility issue. It's a this Jonathan and I laugh. And if you're not watching, I basically mimic the like stimulation of a colon. And what should happen as our bowels move and as our body works to push things out of our body, we have colon stimulation. And I always do this little movement with my hand that mimics a colon stimulation. So and by the way, that is more common than not for most people. And so the question is, okay, well, why is there motility issue? So we've got hydration. Nutrition certainly plays a role here. If someone's eating a lot of processed foods, yeah, that can definitely cause a loose stool or chronic constipation. It can kind of go either way. Fiber intake is really important, especially for me, especially when I was kind of coming in that middle ground state. And once again, we do see this a lot in that middle ground state of I can kind of go either way where I'm like, okay, some days, but then I'll miss a couple days here and there with the bowel movements, or I'll have like little rabbit pebbles kind of looking things, which is an indication of constipation as well. And I started eating like a bowl, and I'm not talking a tiny bowl. I'm talking a big bowl of well cooked greens with some fat in it collard greens. I'm actually making collard greens tonight for dinner, like a big bowl of collard greens, of spinach, of turnip greens. I would do a mixture of different types of greens. And I mean, man, this was hugely, hugely helpful for me for quite some time, especially even reacting to certain vegetables, broccoli, cauliflower. I had a lot of SIBO issues. Once again, this is also pretty common with constipation issues. So I would have these issues, and once again, I share my story as an example, and I have dozens and dozens and dozens, if not for constipation, I mean hundreds and hundreds of case studies when it comes to constipation issues. This is a big one, and making sure we are getting vegetables. And I'll say, really, if you have a lot of GI issues overall, a lot of gas, a lot of bloating, you do probably have some gut overgrowth issues going on, which we're also going to talk about. But adding in really well cooked, I'm not talking lightly cooked, I'm talking well cooked greens. Make sure you chew them, make sure you have a good source of protein to pair with them. That can go a really long way in helping with some constipation issues. And the greens specifically play a really big deal. Sorry, Cusco's in the corner here playing and being a little crazy here. He's always super cute. So that can be very, very helpful. So looking at nutrition, making sure we're having whole, nutrient-dense food, good proteins, good veggie intake. I'll also say, especially for a lot of women, menstruating women, sometimes going too low carb can cause some backup issues, and increasing that carbohydrate intake, whether that's from, a lot of people do well with rice, especially white rice. That can be really helpful. Bonus tip, cook it in some bone broth. Super yummy, and the leftovers are even better. Potatoes of any sort, starchy vegetables, a lot of squashes, different things like that. Pumpkin can actually, and it is fall as of the recording of this episode, pumpkin can be really helpful. This can also be very helpful for pets. This is commonly used, especially with dogs. I know when I had my dog, anytime he would start to have constipation issues, I just pull out some pumpkin, give him a little pumpkin, mix it in with his food for a couple of days. No big deal. No major issues. This would clear up pretty quickly. So that can be a really valuable tool as well. So nutrition, certainly a big one here. Then we can start to peel back even some more of these layers here. So if you have kind of constipation issues coupled with gas, bloating, acid reflux, abdominal pain, abdominal discomfort, maybe even some pain in your stomach, we have like actual like stomach, and your stomach's on your left side for reference. I'm not talking about your belly, which would be, small and large intestine. I'm talking about your actual stomach itself. That can cause some issues. So gut overgrowth issues. This can be something like H. pylori in the stomach. Even just stomach inflammation can play a big role in this. Raw cabbage juice can be really helpful and really beneficial. There's also a supplement called Gastrozyme that if you have a lot of stomach inflammation, that can be really helpful. It's very soothing, helps to bring that down. And sometimes that's even better than supporting stomach acid production when we get into that side of things. SIBO, small intestinal bacteria overgrowth, is super well known to cause constipation in a lot of people, and or alternating constipation, diarrhea, constipation, diarrhea. IBS is also commonly is a blanket diagnosis of, hey, you've got a lot of stomach issues going on, you've got a lot of GI issues going on. We don't totally know what it is, so we're going to label you with IBS. IBS-C would be IBS with constipation. IBS-D would be IBS with diarrhea. Most commonly, that is linked to SIBO, small intestinal bacterial overgrowth. Even people with yeast and fungal overgrowth, that can definitely cause some constipation issues, especially when there's a lot of, so when yeast and fungus overgrow, they release toxins into the body. It's what naturally happens when they're contained and where they're supposed to be, not a big deal. So it's when these things start to really overgrow that these become a major issue. So that can cause a lot of constipation issues. Then we get into things like parasites. Parasite overgrowth, yeah, that'll definitely be a major contributor to constipation issues. And we want to look at parasite overgrowth through blood work. the bacteria, yeast, and fungal issues, we can look at through blood work. We can look at it through some other mechanisms as well. Urine is a really good way to look at this as well. The organic acid test is a test that we commonly use to look at mold levels, or if we're thinking mold might be an issue, a mycotoxin issue going on. But the whole first page of that test is looking at yeast and fungal markers, which is the first section. Then the next section is bacterial markers, but bacterial markers specifically related to SIBO, small intestinal bacterial overgrowth. And then we have the last section on that first page is other types of bacterial issues. The most commonly well known for that one is C. diff. So all of those can be major contributors to constipation. Another really big one, and I don't think enough people really realize the significance of this. And, for me, this was a really big issue for me. And once again, we do see this being a major, major issue for so many people that we work with, and that's liver and bile issues. So the liver is on our right side. I love our liver. It's a very large organ, considering, compared to some other organs. It can regenerate itself, which is super cool. It also has so many jobs. And one of those big jobs is producing bile. And what bile does, bile has a lot of roles here. And if you listen to this podcast really regularly, I'm sorry, you're going to hear me talk about this so many times and have already heard me talk about this so many times. But bile is produced in our liver, then stored in our gallbladder. So if we don't have a gallbladder, that can be a major issue. Most people with no gallbladder tend more towards diarrhea because there's bile just floating out in the body, and that can cause loose stool. It can cause a lot of urgent bowel movement issues. But when it's stored in the gallbladder, especially if we have a history of eating low fat, if we currently still eat a lower fat diet, the bile's not being used as regularly as it probably should be. And keep in mind, fat is an essential nutrient. We all need it. We all need it every day. We will die without it. Protein and fat being the two essential nutrients that we absolutely have to have. So when that bile gets stale, it can get kind of sludgy. It can get thick for a variety of reasons. I'm going to talk about a couple here. Our bile ducts can also get clogged up, and parasites can actually play a role in that. Specifically, liver flukes can play a big role. And this is one reason where if we do have a really heavy parasite load, coffee enemas might be something that we talk about and think about, because it helps to really flush and clear out a lot of that bile, among many other things. So this bile can get really stale, can get sludgy, and that can be a contributor to constipation issues. Toxin overload issues of any kind, heavy metals, mycotoxins, environmental toxins, a combination of all of these, that can really impact our bile, because bile does play a big role in our detoxification pathways and pushing things out that shouldn't be there. Bile is also largely recycled, which means that if it's stale, if it's kind of sludgy, and we do have a lot of toxin overload issues, it's going to have a harder time pushing this out. It's going to have a harder time being reabsorbed back into our body, and that happens in our large intestine. And we can just have a lot of issues going on with it that can contribute to constipation. So toxin load and just overall liver health, bile duct health overall can play a really big role in constipation issues. And for some people, it can go the opposite way. They can end up having looser stools and that kind of issue. So those are the big things I think about when it comes to internally in the body. Now, I'll also throw in movement here. If you are very sedentary, I'm talking you barely move, barely walk, like barely are standing up, and you're sitting down the vast majority of the time, that can also be a huge contributor to constipation issues, especially if you do that after meals. So one of the easy ways to support digestion naturally, especially if you don't have a ton of gut issues, you just sometimes you feel kind of bloated, sometimes you feel kind of constipated and have just a few of these issues going on, then walking after meals can be very, very, very helpful. In addition to helping just move things along in our body, and that's really what the movement, and it doesn't I'm not talking crazy movement. I'm talking like a 5 to 10 minute walk or getting up and just cleaning up, moving around just a little bit. It helps the digestive process, especially because digestion is a north to south process. So if we can keep our bodies very upright and kind of move just gently, that can help move things along and push things out as they should be. Movement also after meals especially, it can be very helpful for regulating blood sugar. So that's like an extra bonus that you can get with adding in just a short walk or a little bit of movement when it comes to post-meal movement or post-meal care. Like what are you doing for your body post-meals? And just getting some gentle movement can be really, really helpful, really, really beneficial. So lack of movement can play a really big role here. Then we get to what I would consider the really big one. You're going to hear me talk about this in all of these topics, and that is the energetic or emotional component to some of these things. And I do want to be clear that I have so much experience with this side of things, and I can't think off the top of my head, I cannot think of a case where this has not played a role in constipation, especially in individuals that we work with severe constipation issues. I'm talking go like once, maybe twice a week. And even so, then it's hard to push out, it's uncomfortable. There's like your belly, you can feel it in your belly. And that is this emotional component of holding on. And I think there can be a lot of different aspects and pieces that go into this. I'll say, there's probably going to be some dysregulated nervous system, just blanket dysregulated nervous system issues going on here. And once again, this plays a big role in our digestion. That can play a big role in our liver and bile health. And a lot of times when we see this constipation, it's almost an emotional swallowing or an emotional of holding on to all the things and not letting go of those pieces. And a lot of this can stem from early early childhood. This is a really big one. This was obviously really big for me. Growing up with a single parent alcoholic, I learned very early on that in order to keep the peace, I had to swallow all of my feelings. Anytime I try to speak up, anytime I try to say something in regards to her drinking habits, anytime I try to speak up for myself, anytime I try to express myself very genuinely and authentically in how I was affected by her drinking, even, I mean, the first family therapist I went to, and I didn't realize how big of a trauma piece this was until last year when I went back to therapy. But, the first therapist we ever went to, my mom was really good at being a high functioning alcoholic. And so she was able to disguise it pretty well. Most of our family didn't even know until a few years before she passed away that she had a pretty serious issue, addiction issue, and I think it helped explain to a lot of my family members why I left and never really came back and really distanced myself from. And it wasn't about anyone else. It was really just about her. I just needed that space in order to do a lot of my own healing work, and that consequently led to just being more disconnected from my family. And so, I just learned that really early on. So that's where a lot of my constipation issues stemmed from. And then I think, I'm just kind of like looking back as I've thought about this, I was in an abusive relationship in my early 20s. And I think that also played a really, really big role in, once again, just like shoving things down, not feeling safe, not feeling safe to even express myself because of fear of repercussions, whether that was a physical or emotional abuse and different things like that. So just like my body just learned to shut it down. And I'll say even when I got divorced last year and made all of these shifts in my life, I'll say my digestion to this date over the last year, almost year and a half now that I made all of these changes, my digestion by and large, outside of getting that really bad case of food poisoning. But even still then, my bowel movements were still really good. I just had some other issues going on. I mean, just the consistency of bowel movements, the quality, man, it's never been better. And it's not like I've done very little gut work outside of, once again, like this acute food poisoning kind of issue that I experienced a few months ago. But I did one parasite full moon work last December. I just did a very short one in early October here. I'll probably do another one either December or January. And I mean, very little compared to what I've previously done. So this is a really big deal. And I really contribute this to just the amount of safety that I feel in my life now with my current partner, the all the work that I've done, just the level of feeling safe inside of my body. Like, man, has that gone such a long way when it's come to my own healing journey, specifically with constipation. So I think that's a big deal. So I'm trying to think. I think that's it when it comes to constipation. The other thing I just want to note here as I'm looking at my cup of coffee, if you have to rely on caffeine, whether that's coffee or tea or something else with caffeine to have a bowel movement every day, you have chronic constipation issues. That is not what should happen. I'm not saying you have to go like first thing right when you wake up. Most people do just because their body tends to be in that cycle. But if you have to rely on these kinds of drinks to have a full, complete bowel movement, you have chronic constipation issues, and it's worth looking into if you don't want to rely on those things, because that's a sign that something is going on. So I think that's a good layering with constipation. So just I'll wrap up and kind of put this all together here. So when we look at chronic constipation issues, and if, we don't work with a lot of people who they're like, oh, constipation is my only issue. It's not typically who we're working with. We typically work with people who are like, oh, I'm constipated and I have this laundry list of other symptoms that I'm also struggling with. And so we like to pair, okay, bigger root causes, what is going on? Obviously we're going to look at toxin load as a big one, parasite overgrowths as a really big one, and then subsequently other types of gut overgrowth issues. We'll look at nervous system regulation, trauma healing, that kind of things. But then also as we're putting a plan together, and okay, where and how do we want to start in healing overall issues? These are the other things that we're also going to be looking at. And this is, once again, like when we work with someone, we're looking at 5 main areas, and we revolve around these 5 areas for essentially all of our healing. And that is nutrition, lifestyle, movement, nervous system regulation, and then targeted supplementation. So it's a really big deal, the constipation thing. And by the way, if you are constipated, and once again, I contribute this to a huge piece of my own chronic issues that I experience. If you have chronic constipation issues, and if you've had those for, we could even say a couple months, definitely a year plus, you have toxin overload issues, because stool is one of the main ways our body gets rid of waste, and that includes toxins. And if you're not regularly pushing that out, you are reabsorbing them. And so this is a huge foundational piece that we do want people to have regular bowel movements as best we can when it comes to someone's healing kind of protocol. So that's also a really big deal. So, we're looking bigger picture, and we're going to use more targeted supplementation for looking at this bigger picture, but we're also going to be using nutrition, and that includes hydration, by the way, lifestyle things, movement, gentle, all of these things to help and support with someone's constipation issues. Castor oil packs can also be really, really helpful for a lot of people with mild constipation issues. For really significant chronic constipation, I don't say move the needle that much, but definitely for chronic constipation. So I think I'm going to actually break this episode into a couple pieces because that took me about 30 minutes to go through. So I'm going to do lower back pain as the other one on this episode. I'll definitely do another one, and I'll definitely do thyroid because I think that's super important. And then I'll pick another one. I think bloating would be the other one that I'd want to talk about. It has some different, similar to chronic constipation, and there can also be a lot of differences here. So I might do bloating, might do something hormone related, but we'll have that episode out in the next couple of weeks so that we can continue on this conversation. And then once again, if you have other ideas, suggestions, symptoms that you would like me to break down, more than happy to do that. So let's talk about lower back pain here. And I'm going to take a little bit of a different approach for this one and start with the physical side of things. So when we think about lower back pain, once again, I'm going to ask some questions here as someone with a history of lower back pain and having worked with so many people with lower back pain. And the first question I'm going to ask is, where is the pain? Is it square across? Like, is it just a straight line across the lower back? Is it on one side? Is it on the other side? Is it very centralized? Is it actually lower back pain on the very top of the glute versus in the lower part of the actual back? Is it more hip related? So I've got a lot more specific body mechanic issues and questions when it comes to lower back pain. And I think that's where a lot of people start. And there's a lot of other pieces that go into this, which is where obviously I want to dive into here. But I'm going to stay with the physical here for just a little bit longer. So, commonly this will come about if, someone's going to start with some imaging or go to physical therapy. And I have been in that boat too. And I remember when I got my MRI done on my back, and they were like, oh, you have a disc protrusion. It's going up. So I had L5S1, which is like the very low part of your back. So it was going up. And then it was also on going out to the right, which is the reason why I lost feeling in my right leg, because this disc was pushing out onto the right side and essentially pushing on a nerve that contributed to the numbness that I felt for close to a year in my right leg. So, and here's the thing. I did all of the things when it came to lower back pain. I saw eight physical therapists. I like physical therapy. They have a time and a place. And once again, they are Western medicine trained. And a lot of times they will only look at your low back. The number of people who told me I would work with them and be like, yeah, your lower back, your glutes are a little bit tight. Your hips are, look pretty fine. And that's all they would really look at. And I was already strong. I already had a very baseline muscle connection. I had these things. So I was able to almost subconsciously compensate for a lot of the tests that they would run on me. And in theory, I looked pretty fine for almost all of these people. And I had, really bad, really, really, really bad lower back pain. I couldn't sit or stand or drive for more than 10 or 15 minutes without needing to move, without like having to switch positions. Even laying down, I got pretty squirrely and would need to shift a whole lot, which obviously impacted my sleep. So all of those things can play a role. It wasn't until I got further down the line, I saw a spine and pain specialist, and I had 9 different procedures done on my back, and I saw surgeons and orthopedic doctors and strength and conditioning coaches who were also physical therapists, dry needling, cupping, cryotherapy, flotation therapy, acupuncture. I did all of the things. Really so many different things. And sometimes I would get relief in certain areas, but largely I was not. And this did start with a car accident. This doesn't have to be the case, by the way. I'll also say, if you MRI, most people will say 30 and up, but absolutely for sure 40 and up, we're all going to have disc issues. It's just what happens. And just because you have a disc issue doesn't mean you have to live in pain. There are other things that can be going on that are also more likely to be going on that are contributing to your pain. And not saying that it doesn't matter, because it does. And I think so many people get caught up with, oh, I just have a disc issue, or I just have an anterior pelvic tilt. meaning that they push their butt out and they overarch their lower back. And they've been to physical therapists and they're like, no, this is just who I am. This is how I have pain. And I can tell you, no, that's not how this works. There's a lot of factors here. We need to look at all of these factors. And I'll tell you, with lower back pain, pelvic floor work is one of the most valuable things you can do if you have lower back pain. That is probably the only physical therapist. Sorry, I actually saw non-physical therapists. If we include pelvic floor physical therapy, I saw her for a year and I learned a lot from her. She was awesome. She was great. I asked a ton of questions every time I was in there, and she largely did a lot of manual type work with me and helping me understand, these smaller muscles. And she used an ultrasound as I was actually like doing different exercises, which if you can find someone who does that, amazing. Also, if they can do an external and internal ultrasounds to look at everything going on in your pelvic floor, even better. And I was able to see how different muscles would start to activate would work with the left side activating sometimes more than the right side, or the right side compensating with different muscles. And it was really fascinating. And I learned a ton from her. Unfortunately, I didn't see a lot of the benefit right off the bat because I was so bloated that essentially I had no access to these deeper pelvic floor muscles because I was so bloated and I had these chronic constipation issues that it was impossible for me to properly activate and use a lot of my pelvic floor muscles because of the bloating. So bloating is a really big contributor and kind of one layer that we think about when it comes to lower back pain. If you've got chronic bloating, your pelvic floor is not in a good spot. I can tell you that 100%. It's not in a good spot. It's not working properly. You should probably be cautious if you are doing any sort of bigger lifting until we can start to get that down and start to retrain this pelvic floor, these lower deep abdominal muscles to work properly. Otherwise, you can get very, very hurt. It is more common in women, although it is not exclusive to women. Men can absolutely have pelvic floor issues as well. So pelvic floor can play a really big role. I'll tell you, hips, man, do the hips play a really, really big role in chronic lower back pain. Most of us only do things in front of us. Occasionally we'll do things like, forward and backwards, but most of us, even in workouts, are only doing things front to back. Lunges, squats, deadlifts, a lot of it, hip thrusts, glute bridges. I'm trying to think of other step ups. All of these things are largely front to back kind of plane. The biggest plane that people do not work at, and this is a big thing whenever I'm designing my own programs or designing programs for other people, like our clients, which we will absolutely do and help with because I have over a decade of personal training experience. Brendan has been in the movement space and differently in the movement space for a very, very long time as well. And so we need the side to side. Side lunges are one of my all-time favorite exercises. They're always in my program. Anytime I'm doing any sort of program, I'll tell you there's some sort of side lunge variation in my program. Sometimes that's side lunges, sometimes that's Cossack squats, sometimes there's just different lunge variations that where I'm forcing my body to go side to side or laterally. Internal and external, specifically internal rotation of the hips as well, is something that is, there was zero physical therapists that talked to me about my internal rotation of my hips, which was a huge contributing factor of my lower back pain. I'll also say this is a huge contributing factor if you have piriformis pain, which is pain on the basically the outer part of your butt. There's a muscle called your piriformis, and it is one of the most common reasons why women in particular go to physical therapy. And internal rotation of the hips plays such a big, big, big role in this. So looking at internal rotation, strengthening internal rotation, doing these bilateral type movements, super, super important and goes such a long way in keeping our hips really healthy. I'll also say, for Jonathan, my fiance, he started having hip pain at some point last year. And I was like, hey, why don't you try maybe doing some side lunges and just kind of see how those feel? took his pain right away. He started getting it back towards the end of his cancer treatment this year. And I mentioned, hey, have you started to reintroduce side lunges into your movement program? He's like, oh my gosh, I forgot. So, and it went away after the first time he did them. So that goes a really, really long way. Couple other big things to think about when we look at lower back pain. And once again, I commonly do not see physical therapists looking at these things. Your feet. Man. So whenever I think about the body, I really think from a physical mechanical standpoint. I always think feet going up to the head, because that's really our foundation is our feet. And if we have feet issues, the likelihood that we're going to have knee issues, hip issues, back issues, neck issues goes up significantly. And even a lot of chiropractors, I know a lot of chiropractors, even my chiropractor that I saw for many years back in Richmond, who amazing. I have never gotten an adjustment like his, and it makes me very sad that I'm no longer there and can get regular adjustments because they help so much keep my body in just such a good position. But most chiropractors will go top down, and I like to go bottom up. And so feet, if you wear shoes all of the time, even in your house, I can guarantee you have foot issues. The bottom of your feet, like your toe separation, the strength of your arch. There's so many little muscles in your feet. Rolling your feet out on a ball, whether that's a tennis ball, lacrosse ball. I love a good lacrosse ball, a golf ball. All of these kinds of things can be really helpful and really valuable. And just kind of start to wake up your feet. But strengthening your feet is a really big one. Same thing with your ankles. If your ankles are not in a good position, which by and large, most people with ankles are not in a good position, and the taller you get, the more likely you are to have issues with your ankles, and being able to have that really, really good ankle mobility to like sit down low. But this is a huge contributor to lower back pain as well, among knee pain and hip pain. The other piece, so feet, ankles, also your mid back. And most people, you can kind of arch back, you can round forward and feel generally okay. But once again, this question of rotation for that mid back. Can you internally and externally rotate comfortably? What does that range of motion look like? What kind of control do you have over that range of motion? And by the way, if you have hypermobility issues, I'm going to bring you the opposite. Do you have strength and control over the ranges of motion that you use? The answer is probably no. Otherwise, you wouldn't have as much pain as you do. And there can be other root causes of hypermobility. Maybe that's another good one. I'm just going to put that on my list here of things to really look at to help with hypermobility. So yeah, but how can you open? Can you close? What does that look like? Windmills are a really great option. There's something called thread the needle, and the way I do thread the needle, if you look at like a yoga thread the needle, usually yoga thread the needle only goes under and doesn't open up. The way I was trained and like to do it from a mobility corrective exercise standpoint is going under, but then also opening up and being able to comfortably do that without largely shifting your hips is a really big deal. And by the way, I have all of these movements and exercises on our YouTube page, so you can always go to our YouTube page and look some of these movements and exercises up, because I have, hundreds of videos that go through this. I also did, this was a long time ago, maybe 5 years ago, I did a mobility challenge and I went through each part of the body here. So if you go to our Facebook, I did that in our Facebook group. So if you go back to our Facebook group and if you search old history, we don't delete anything. So it's still in there, and search mobility challenge, you'll be able to see a lot of that. And it was completely for free. It was in the group. So you can still have access to that and still see it. And it'll take you through different mobility movements, starting from your feet, working all the way up here. So that's a great resource for you as well. And I'll be sure to link our YouTube page in our show notes here. So from a physical standpoint, there can be a lot of pieces that go into lower back pain. I'll also say the glutes also play a really big role in this. And once again, most people, we use the front of our body a whole lot, and we're not using the back of our body all that much. And a lot of that goes to, we can't see it. We can't see what the back of our body is doing. So things like doing rows, like pulling and squeezing your shoulder blades back and together, glute bridges. And I have a very particular way of doing glute bridges, which I've never seen anyone explain glute bridges the way I do this. If you go on our YouTube page and search glute bridge for lower back pain, it'll come right up. It's like a 5.5 minute video. And all I'm doing is walking you through how to do a proper glute bridge. Follow those cues, follow those instructions very closely, and see how you feel. But a lot of people don't have actual really good glute strength. And there's a lot of muscles in our group. A lot of people with that kind of upper glute kind of back pain, that's actually because the meaty part of your glute is not working properly and it's not activating properly. So doing something like a glute bridge, I also really love like a single leg toe touch, single leg deadlift. Those are really, really valuable things that can help strengthen the backside of our body, which is a huge protector from lower back pain. And I've worked with so many clients who, anytime in the past they had tried to do any sort of hip hinging, deadlifty type of movement, they had a ton of pain. And it was really getting their glutes to activate and then opening up their hips. That's what made the biggest difference when it came to resolving their pain. And once again, there's one client in particular, and I have a great testimonial with her. It's a video testimonial that we've shared. And man, she came to me in really rough shape. She was really young. She was in her 20s at the time. And we got to the point where we were doing powerlifting, or I'm sorry, not bodybuilding. Yeah, powerlifting movements and powerlifting programs, bodybuilding. Okay, we certainly did bodybuilding programs, but we did powerlifting. Really got her strength up. She was able to squat. She was able to deadlift extraordinary amount considering where she started. And it's really, once again, we had to peel back the layers of, okay, what all is going on here? We also did some inner work as we kind of later did some, as our work evolved and shifted and changed, and we did some gut work and some other types of work as well that also helped. But by and large, the mechanical side of things for her, man, that makes, extraordinary difference for her. So there's a lot of pieces that go into that from a physical standpoint. Now, if we look kind of inside the body, once again, bloating. Bloating is a really big one, chronic constipation issues. And that's because you're pushing your belly out, and the chances that you're actually pushing your body into an undesirable position mechanically, because your belly is probably being pushed out, and then you're getting this big arch in your lower back. That is not what it's supposed to do. You have a lot of muscles back there, but they're small. They're not designed to take the brunt force of all of that, and we should really be tucked in more, which allows a lot of our core muscles. By the way, our core really goes all the way around, but our abdominal muscles, our deeper pelvic floor muscles, our glutes, our hamstrings, that should be taking more of the work because those are bigger muscles. Even our back, like our upper back, our scapula muscles, our lats, like we got some big muscles going on back there, and our low back has some teeny tiny muscles that also can play a big role here. I forgot one other thing when it came to the mechanical side that I just thought of when it comes to bloating. So another big thing that can happen, especially when we do have a lot of bloating issues, is we can have a lot of QL pain. And so if we think about, we have the spine, which is in the middle of our back. On either side of that, not right directly on the spine, because we do have some muscles there called the erector spinatus muscles, but out just a little bit further, but not quite on the side of our body, which is where our obliques are. There's a muscle called the QL that for many people gets really, really tight. And a lot of this has to do with your pelvic floor. There can be some other things related to this, but it can cause a lot of lower back pain as well. And as my lower back pain shifted and evolved, like QLs became a really big issue and a really big deal. And this is where a lot of the unilateral training can, and different types of core training can really come into play here. I think about when we think about core movements, there's a lot of different types. We think about rotational. We think about like wood choppers, our rotational kind of movement. We think about anti-rotation, which would be like a Pallof press, and you can look all of these up, by the way. We also think about strict abdominal muscles, like a crunch. We can think about that. What about unilateral carries? Really good. Farmer's carry, suitcase carry. overhead carry, even just like a carry right up by your collarbone. All of that stuff really helps to stabilize and causes some rotation or anti-rotation, which is very supportive of the core. But then we think about obliques. We want to work our obliques, and then we want to work our TVA, our transverse abdominal muscles, which is part of the pelvic floor. We want to get deep pelvic floor strength. We want to get glute strength. So all of these things really come into play. And I'll say, by the way, just most personal trainers don't have much of an idea about most of these things. So just for reference, if you are looking for a trainer, you can ask us if you want strictly for personal training. If you want someone in person, obviously that needs to be local to your area. I do have a great recommendation if you are in the greater Richmond area. And this person also does online coaching as well, or online personal training. So if you're looking for that side of things, I do have some great resources for you. So please don't hesitate to reach out. And then we will obviously help our clients while also digging deeper into bigger issues going on with any of this kind of stuff. And I take an active role in helping with a lot of the chronic pain side of things and helping to unpack and uncover a lot of that. So bloating can play a really big deal. Any sort of gut issues, gut overgrowth issues, SIBO, candida, any sort of fungal issue like bacteria, yeast, fungus, parasite issues, that can obviously play a big role. Constipation, I'll say, and or loose stool can also play a really big role. Just as if there's any inflammation going on in your actual intestines, leaky, quote unquote, leaky gut, which is actual intestinal permeability, which is almost one of the last things you want to look at. But all of that can play a role in lower back pain. Dehydration is also another really sneaky one with this, where if you are chronically dehydrated, one of the more common signs that, once again, I don't see this talked about a lot is dehydration. If you are chronically dehydrated, it can show up as lower back pain. It's one of the known ways that chronic dehydration shows up in the body that I don't see a lot of people talking about. So that can play a really, really big role and be a big deal when it comes to healing. That if you're not drinking enough water, I mean, we could do all of the things. Your body can be mechanically in a great place. We can get your gut health in a great place. But if you're chronically dehydrated, you just got to drink more water. We got to make sure you're drinking more water and also absorbing that water. So that's where the electrolyte side of things comes to play. Also said sleep plays a big role in this. And really, I'm going to say inflammation can play a really big role in this. So when you think about inflammation, there's so many things that can play a role: lack of sleep, poor nutrition, dehydration, gut overgrowth issues, toxin overload issues can play a really big role. So all of that stuff can also play a role. Hormones, especially for women, but I'll even say low testosterone for men, can also play a role in chronic pain issues, where if your testosterone is low, and even like in perimenopause, when our hormones, most of them are starting to drop a little bit, this is a really big time where chronic pain becomes a really big issue for many, many women. And a big piece of that can be hormone driven. And so it's, okay, well, is it hormones? Is it truly hormones? What is impacting the hormones? Also, what is the mechanical body? Where is that going? And how is that playing a role in all of this? Because things will catch up with us in time. Our body's ability to recover, it does slow down as we age. And I don't want to give like a specific age of, as of this age, this is where it starts to decline. But like mid-30s into your 40s is probably where that's going to happen, especially if you're not actively taking care of your body and warming up your body and doing mobility stuff or corrective exercise and kind of staying on top of that, where a lot of these issues can come up here. So all of that can kind of play a role. And the hormone piece is often, I think, also dismissed or not really thought about. Low progesterone and low estrogen, I mean, all of them can play a big role in our pain. And then if you have a lot of hormonal imbalances, and when you get your period, you feel like that lower back pain and it's significant, it's very, very, very painful. It's really an inflammation issue. And it's your uterus getting really inflamed as you're getting ready to release the uterine lining, as you're getting ready to start your period. That can be fixed. Yeah, that doesn't have to be a thing. You don't have to cramping. You might feel, what I always tell women is you may notice, it is normal to notice that you're about to start your period. You're like, I can feel it. I can feel something different in my uterus. I can feel, maybe it's not even bloating, but just a little inflammation going on in my belly. It doesn't necessarily hurt. It's not very uncomfortable, but it's different than normal. That is fine. I would consider that a normal part of your period. Now, if it's anything more than that, not so normal. If you have to take Advil, ibuprofen, Motrin, like any of these types of things because it is so painful and you feel so inflamed, not normal, not very, very common, but that does not have to be the case, and no, birth control is not your only option. Looking at your liver is one of the first things that we'll do if someone has very, very painful periods, especially when it comes to cramping, headaches, migraines, lower back pain, hip pain, kind of that. I don't know if you ever have had that shooting pain kind of down one of your legs, but that's all related to the hormonal shift that happens as we are getting ready to start our period and the actual start of our period. So that can play a role here. Now let's look at the wrap up here with the energetic and emotional side of things. So if we look at our lower back, that is if we look from, the energetic body, our root chakra. And our root chakra has a lot to do with, there's many pieces here, but I'll say the two big pieces that I often see is being very disconnected from our bodies, which once again, this is very, very common. Most people are in their head and don't have a strong connection to the rest of their body. And I do find movement a really good way to strengthen that connection to your body, that mind muscle connection, just mind body connection, not even muscle related, just mind and body connection. And so if we're really disconnected, that can show up as root chakra issues. And another big thing is if we're not very rooted in who we are, which is a big deal for a lot of us. Once again, especially if you experienced a lot of childhood trauma and didn't have the opportunity or the safety to explore who you are, what you like, who you want to be, different things like that. This can show up as lower back pain down the road. Same thing, if you were in, let's say, a really bad relationship, as an adult, whether that's early adulthood or any time within an adult, and you come out of that relationship and we can call it a toxic relationship. Come out of that relationship and you were manipulated a lot. Maybe you were with a narcissist, maybe you were with someone who was abusive and really shut you down, really forced you to isolate yourself a lot to this other individual. This can show up as a lot of root chakra issues and not being grounded in the self, in who you are, and not knowing who you are. And that also needs to be taken into account. And once again, if we've got a lot of these root chakra issues, you're going to have lower back pain. Like I can almost promise you, you're going to have some lower back pain issues. And so we also need to look at this nervous system, energetic, emotional component of this. And all of these things matter. And so once again, like the reason I wanted to go through this is just to look at, if you have lower back pain, it's not as simple as, all right, just go to physical therapy and you'll be fine. It's, well, what are all of the things that can contribute to this? If you have chronic constipation issues and you go to a GI doctor and they scope you and they say you're fine, and they just tell you to take Miralax for the rest of your life, and you don't want to do that, obviously that is your choice. If you'd like to do that, don't highly recommend it, but that is your choice, your body, your choice. But we need to look at all of these things, and none of these issues, none of these chronic issues, excuse me, are as black and white as many people make them out to be. And it's not about just taking a supplement or just eating a different way or just taking a pill. If you really want to heal your body from a root cause perspective, we need to look at all of these things, and all of these things matter. And we need to peel back all of these layers. And once again, we can give people, and we see this not all the time, but we do see this occasionally where if someone really wants to work with us, and we try and be very clear and upfront in how we work with people, and they don't want to do the nervous system side, they don't want to do the emotional side, they don't want to look at this side, and there's a limitation in the work that we can do and the results and the successes that we can really see, because that piece does play a really big role in so many, arguably all of these chronic issues. And so I think that's not to be discounted, and I think it is discounted in really significant ways. And I also think if you're only looking at the nervous system and emotional side of things, we're also missing these bigger pieces of the puzzle here. So I'm going to wrap up there. Once again, if you want me to do more of these episodes, I'm going to do at least one more. But if you want me to do more of these, comment, let us know on Instagram, TikTok, Facebook, send us an email, info@trifectacollective.net. Please just let us know. Thank you for listening. As always, please like, subscribe, follow. If it resonates, a 5-star review really, really, really means the world to us. Thank you for joining, and we'll see you next time.